Hello and welcome to Different Perspectives. I am Paul Ndiho. In a significant boost for healthcare in West Africa, Ghana's Urology and Nephrology Center of Excellence, a $40 million state-of-the-art facility in Accra, is already having a positive impact across local communities. Now, the largest of its kind in the region, this three-story medical center is redefining how kidney and urology conditions are treated, offering world-class healthcare for everything from chronic kidney failure to advanced urology procedures. It houses a 30-bed dialysis suite, 70 inpatient bed, and cutting-edge wings for diagnostics, outpatient care, research, and training, helping Ghana not just treat patients but build long-term capacity. To learn more about this facility, Ndiho Media spoke with James Amoa, lead nurse at Ghana's Urology and Nephrology Center of Excellence, who shared how the hospital is saving lives and restoring dignity to patients. And Kwado Bafwa Ahenkora, a patient and president of the Renal Patients Association of Ghana, about the urgent need for affordable, high-quality care and why this center is a lifeline for thousands. Welcome to Different Perspective.
Thank
Thank you
you
very
very
much
much.
for joining us.
It's a pleasure to have both of you on this show.
It's a pleasure
Thank you very
to be here.
James, you are a lead nurse at the center, at the Urology Center for Excellence in Kalebu, Accra, Ghana. Uh, what can you tell us about this center? Bring us up to speed where things are as we speak.
What we do is there's a center on its own that manages all kidney-related issues and other problems relating to the urinary bladder and also the urinary system. And so currently we have surgeries being done in this new center. We have patients who are admitted and treated throughout the treatment process. We have patients who come for dialysis, patients who come for all services relating to the kidneys and also the urinary system. Another point is that we also get patients across West Africa from Nigeria, Sierra Leone, and also in Liberia who comes here for treatment. So it's been very busy since December. We are seeing a lot more cases now than when we came in December.
How about you, Bafwa? You are one of those patients who has had the benefit or the privilege of taking advantage of this dialysis center in Accra. How much of a difference has this made to you?
A lot big difference, like James is saying, initially when we started it from the medical block. We came to the cabin, and currently we are at the Urology Center of Excellence. Very good place. Sometimes we even fight to down that you put the air conditioner because we are feeling too cold. But we are enjoying the process now, and then everything is moving on very smoothly. Honestly speaking, I've traveled a couple of places, but I think Ghana now we are one of the best places as a dialysis center that the patients are now enjoying it now.
Speaking of the best dialysis center in Ghana, what does that mean for people like you, James, who works at the hospital? How a difference have you seen ever since this hospital was officially open to the public in terms of traffic, in terms of people who come there? What are their issues?
We didn't have a lot more machines, we didn't have a bigger space. We could see only a few patients. And then for the few that were around, we had to work around the clock, even in the night, to call patients to come around 3 a.m., 2 a.m. before they can receive their dialysis. Now, with this new center, we have about 30 dialysis machines. Fortunately, the patient don't have to now come at night to be seen. They come in the morning, they have their dialysis sessions, they go back to their various homes, or some even go to their work. For us as staff, that's reduced the pressure on us because previously we need to work in the night to make sure that we can attend to the patient. But now we have a lot more flexibility. We cannot sleep in our homes. And just states now we have a few emergencies that we have to stay around. Aside that, we're able to see all of them clearly. They also go through the treatment schedules without any difficulties. For the old machines, then could easily break down, but these are brand new machines that we have. And so they don't break down. These patients have their normal sessions and they are good to go. The very final thing is that in this new center, we have emergency items that we will need in case somebody has any dialysis emergency. So we have defibrillator, we have emergency medication and that is which previously we didn't have. But now have all of these things available. So that makes our work as health workers much easier and we're able to attend to them without any complications.
I have a lot of friends in Ghana. When I've talked to them, especially for the young ones, they have like their parents who are struggling with some of these issues. I've also talked to patients in Ghana who have to travel from very far from across the country to come in Accra for some kind of treatment. What does this mean for people like you, Bafwa, who has also experienced some of this? Having a center where you can go and you're taken care of. What does that mean to you?
It's a good news, but like you just said, we have people traveling from far and near to come to Kolebu to have their sessions. I can speak mainly about my dialysis people and the rest. You know, we wish they could have more of these centers across the country. If not across the country, maybe in the system regions, the regional capitals, you can have this, and then maybe they can have train more. Even Kolebu, we still need more doctors because sometimes uh, getting a doctor, you need to book and go for your clinic. That one is a normal procedure. But sometimes there can be emergencies. You get getting a doctor is very difficult because the doctors are few. So always they are busy attending to patients. Already we have patients at the wards and all those things. Like I say, the center is doing much marvelous for us. I mean, sometimes James will fight with me. Mr. Ifra, what are you doing here? What are you doing here? And I said, oh, I'm come to check on my people. I mean, when you enter, you enjoy the place. It's good. So if you could have made more of these centers across the country, I mean, the system regional capitals is really going to help a lot. And then we need more nurses, especially dialysis trained nurses, and then more doctors on this because sometimes situations happens, the nurses cannot handle it. They need a doctor to do it, and then that doctor to maybe at the medical, but maybe by attending to patients. The doctors, the renal doctors are few. They are not that much. So we plead with the authorities, the people who are responsible to. We should have more renal doctors, more renal doctor nurses. Prior to we coming to the urology center now, like James was saying, we're going 3 a.m. and sometimes you go there 24/7. The place was working because the machines were few. And it's these few nurses. They are very few. You could see they are just rotating themselves. You could see the nurse is tired because maybe he has worked maybe from afternoon to that deep night. So we will need more of this thing across the country to bring the pressure down on the maybe the bigger hospitals.
James, to Buffalo's point, he brings up a very interesting and important point, especially when it comes to trained professionals. The last time I was there, there was a shortage of doctors, a shortage of nurses, and a shortage of all these specialized people who are dealing with very, very serious uh, uh, sick patients, right?
Yeah.
So, to what extent has the government, has the hospital maybe uh, done something about that?
The shortage of health professionals is across the country. There's been an exodus of a lot of medical professionals to the UK, to the US, to Saudi, and so people are leaving for greener pastures. And so that's reduced the number of medical professionals we have. And the other point is that because we don't have many of them having been trained, the experience that are going. So you have many recruited nurses who are in, but they don't have the experience like the experienced ones who have left the country. So government is working to get clearance for some nurses to be employed, but they must can work through the system and build up their experience. So if one experienced nurse leaves, they need about 3 or 4 inexperienced ones to actually do the work that they were doing. So as a hospital, we try to speak to our management to recruit more nurses who will come so we can be able to show up the numbers that we have. But this issue is across the country. People are just leaving to other countries.
So I remember when President John Mahama was running, he talked about how he was going to address that as one of the major challenges affecting the country. Has he done anything in that regard, especially when it comes to uh, giving incentives to some of these doctors, the nurses, and all these professionals that the hospital needs to be able to serve the people in the country?
this is fifth month of government, so we are still waiting to see when all of these issues are going to roll out. But most Ghanaian health workers like myself, we are motivated by the people we see. So Mr. Bafo is a friend to me. So when he comes to me, I have this internal motivation to do my best to make sure that he lives and survives. So that's almost people in Ghana are actually not health workers. But for that, everybody will have left because the money that is paid is not enough to take care of you and your family and other responsibilities that you have. So we wait for government to do what he has promised, but for them, as for the generality of all the medical professionals, we have this internal motivation to do our best for the people who live in this country. That's why we are still here doing this work.
What does it take to come to a government hospital like this, a state of the art hospital that offers all these services, as opposed to going to a private clinic that does the same thing?
Yes, it's generally less expensive to come to a government facility. You know, for all the government facilities, they get salvage from governments. The medical professionals who work in these centers are not paid by the hospitals themselves. So the government puts human resource, the government supports them, procure some equipment. Like this new building was built by government 100% with no money from the hospital. So in that case, it becomes cheaper coming to a government facility than to go to a private facility. But at that point, the quality of work that we do in our government facilities is much better than some of the private centers that we have around. So these patients still go out there and they still come to us. So apart from the fact that it's less expensive in our government facilities, they get the best of care because government employs qualified personnel, people who have the experience to work in our government facilities. That is why we get a lot more patients coming to government facilities than go to private centers across the country.
How about you, Bafwa, from a patient's perspective? How are things? How do you look at things?
I mean, for me, let me use myself as an example. For 11 years now, I've been in Kolebu. Once in a while, I go out. But the services that I get outside, Kolebu gives me better treatment than when I go outside. I'm not saying what they are doing outside is not good, but the professionalism from the nurses at Kolebu, anywhere I go, I say this, I give it to them. Even though we might have our differences, I mean, sometimes we argue back and forth, but we give it to them. I mean, they will make sure you are good, they'll make sure you are okay. Those who prefer to go to a private one, maybe they don't want to maybe come and queue. Not like you, for example, Kolebu has got a number that they work with, you know. So, like Monday, you have people who are coming for Monday, Tuesday, we have work. So, if you are not within any of the days, you cannot just walk in. Before you can walk in, you have to go and ask or book, and then they will fix you somewhere. So for the private facilities, like, once again, the government hospital is a bit cheaper. Let me cite an example. Now the government hospital is doing, let's say, around 500 Ghana per session. Per session. The government, the private, the least you can get is between 650 to 700. That's the least you can get. Some even charge even up to 1,000 per session. They are also there. So looking at the financial constraints and those things, sometimes you cannot do those things. So the government hospital is good. Like that's how I was saying that we would prefer that the government hospital will equip all the regional and the district hospitals with at least 555 dialysis machines with one trained nurses and that of doctors, so that it will bring the pressure on the major hospitals, because the pressure on them now is Kolebu a day. I can tell you can do about 100 cases a day. The kind of inflow that comes in, emergencies and all those things, and all people prefer to come there. Like I said, the quality is good, the professionalism is there. You get the nurses to attend to you perfectly, give you the right advice, what to do and what to do. So the government hospital is far better, cheaper, and then more comfortable than going to the private.
James, the government spent nearly $40 million in this project, trying to make sure that they bring some of the best uh, facilities to Ghana. Uh, was it a worthy investment when you think about it? Do you have enough traffic coming into the hospital, maybe from Ghana, from across the region, coming in to offset some of that investment that was made on this hospital?
It is a good investment to for every government to invest in the healthcare of its people because the people who are in our hospitals who are sick, who attend to these health facilities, are the same people who will be working to generate income for the government. So government must be able to spend enough money on the healthcare of their people to ensure that once they are not well, they can get the best treatment like it happens in any other country, and then they can continue to give back to the government, the state in terms of revenue. It's a good investment because now Ghanaians don't have to travel to other countries to access dialysis or transplant or any other surgeries that we do in this country. That saves a lot of cost to the individual. That saves a lot of discomfort because if you want to go to a different country, you need to book for hotel, you need to book for other things that you are going to spend. But as long as you are within the country, you have access to your people. There are people who understand your language. These are people you can easily interact with, and that will help you get the best of care. Why this one also blurs, we're also getting people from across the country. So people from South Africa, no, I mean Sierra Leone, Liberia, Nigeria, Togo, and neighboring countries. They're all coming here because they don't have these facilities in their countries. And the good news is that once they come, they pay higher than the Ghanaian, how much a Ghanaian pays. So that will help government to be able to raise a lot more revenue from that.
So you just brought up an interesting point. You said you're beginning to receive patients from across the entire continent coming for specialized dialysis or specialized care
Right.
at this your center
Yeah.
of excellence.
That's correct. Yes. And that's good. So once they also go and tell the people around them the good services that they received, and they recommend others to come. So we've been seeing a lot more of these patients frequently. Currently, we have someone from Sierra Leone who is here, who is coming to receive dialysis and get some procedures done before he goes back to his home country. It is good for us as Ghanaians, and also good for all those within the West African sub-region. But for this center, those who is in Ghana or any West African country might have to spend more to travel to get a visa, go to the US, go to the UK to attend and get medical care. But it's much cheaper here when it's closer to you in your home country. So that is a good thing.
What treatment options do you have?
So once somebody is diagnosed of chronic kidney disease, depending on the person's stage, there are three treatments available. For those who are not at the end stage kidney disease section, where we say that the kidney is still able to function to support the body, they will give them medical management to manage what is causing the kidney disease. For example, somebody has hypertension or diabetes. Once you put the diabetes and hypertension under control, such a person's kidney function is going to be sustained, and the person does not need to go to the end stage kidney disease stage. But once the patient gets to the stage, which is the stage 5, the end case kidney disease stage, then the person needs either dialysis or transplant. Dialysis is the first option because the machine must start working to help you support the small renal function that you have. So you go to the machine cleans your blood, takes away all the toxins, take away excess fluid, and then the person is restored to him or herself. If that continues for a long time, there are a lot of complications that might come. And therefore, there's what we call the kidney transplant, where somebody donates his kidney to another person and then it is transplanted into you. That's one of the best options, the cheapest, because to pay for dialysis 3 times a week for a number of years is going to drain all of you. Some of them experience complications after dialysis, weakness, blood loss, anemia, dizziness, and all of those things. But once you have a kidney transplant done, you not go through all of the difficulties I've mentioned earlier. So medical management, dialysis, transplant are all available in our country, Ghana, and we are able to do all of this with no complications at all.
Earlier, you talked about the exodus of these trained professionals. I'm specifically talking about doctors, nurses, and all the other medical professionals who are fleeing the country looking for greener pastures. In your particular case, why did you decide to stay?
I'm staying because I believe that the people of Ghana must take care of these people. And if all of us leave, there will be nobody to take care of those who are here. So I have my family here, I have my parents here, I have my friends here. I cannot leave because I want to get greener pasture, get much money, while there's nobody else taking care of them. So I'm staying because of that particular reason. Secondly, I also feel that Ghanaians will develop the country. So I must stay and make sure that I develop the country I live in. Those who have gone will still come back with their money to come and do investment, but we cannot all leave. And that's my motivation for staying. How best can I improve myself here in my country? How best can I help the patients who are within my community? How can I also help those around me to make my country a better place to live in? So that's my motivation for staying. If not, I would have left long ago.
You are a president of the renal organization or association in Ghana. When you talk to some patients who are experiencing these conditions, and what are their stories? What is it that they want uh, a hospital uh, center like we are talking about to help them? Or how can the government reach out to these people and help them?
Like how I've been saying all the time, the government will really have to look at this REMA issue very, 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 very careful. Now, James and I will testify that it's just the youth. Take it from at the age of 19 to let's say 50 years. That is where the numbers are. Like I was saying, when you come to Kilimu, you not even get maybe 80 years or 85 years or 70 years person on dialysis. Even if they are there, maybe it will be just be one or two. But the number of about 100 and something patients that we have now, they are all youth from age of maybe 20 to 45 to 50. They are all youth. So now, if this is how it's going to, how is the country going to be? So government will really have to look at it very critical, very, very critical. Transplants we cannot afford. Ghana is not here like maybe where you are, maybe where they have this organ tissue transplant there that maybe when somebody needs a kidney, they can put the person on a list and then maybe when they find a match, they will do the transplant for the person. Here, you need to get a donor before you can do the transplant. So governments really have to look at this situation and then we have to look at the preventive measures because the rate at which the numbers are coming up. Today you go, you see a new face. Tomorrow you go, you see a new face. You go, you see a new face. You keep seeing new face. So you can just imagine. I can say on Polybu a day they can get about 5 new cases. That will be coming for the dialysis. This is Polybu. Kopanoti has not come. Cape Coast has not come. Who has not come. Family has not come. So you can just even let's say if all of them are doing two new cases a day, you can just imagine number. So government will really have to look at it because we the patient that we are there, we wish today we will get up one day, maybe we can get a donor and do transplant and leave the dialysis. It's time wasting. You go there, you waste the whole day there. I mean, you finish some of the things you are even weak. Some of us, maybe advice from James and the rest, we are a bit strong. When we finish, maybe we can go about our normal bits and those things. But there are some people, when they finish, you just have to carry them into the car and take them home for them to go and sleep. And we have a lot of them there like that. So we really have to look at measures to stop the rate at which people are joining the renal issues. And then government should come in. Like I'm saying, when the person becomes a renal patient, it's a whole lot of things. Everything is about money. Our major headache is what government are taking, but there are a lot of problems. Our labs, like I think, just last week Monday, I met my doctor. He said, "Oh, you are doing fine, but you have to do this lab. You're bringing. Let me check." When I went to the lab to check, it's about 2,500. A series of lab is there. Our injection, the injection, not everybody needs it, but most of the people need the injection. That is the erythropoietin. That keeps your HB a little bit up. Is that one to his money? You need about 350 to get it. That one is there. Your BP medication is also there. Ideally, James will testify, we are supposed to be on special diet. We cannot just eat anything just like that. But because of financial constraints, you finish, you go and eat cake and fish by the roadside. You just have to get something to the stomach. You know. So there's a whole lot I would say that sometimes when our leaders are taking decisions, like James and the coach, some of them, they need to get us involved. Then we tell them the reality on the ground for them to know that this is a situation. Because like I was saying, let me use one example, then James can come in. The new urology center that they built, very beautiful. We don't have blood bank there. Yesterday, I had my session. There was a patient who needed blood. When he came, they checked his blood. The blood level was, I think, low. I mean, below the normal requirement. So the nurse on duty was also afraid putting the person because when they put the person on the machine and the blood is that low, we can lose the person. So the nurse was being more precise. If you don't get the blood, I won't put you on. Now here we are. He used to go to the blood bank. Going to the blood bank to get the blood is a whole another matter altogether. Maybe we'll discuss another time. So like we should, the renal unit, as we go to the new center, we should have a blood bank there. So some of these emergencies, you just fall on it to save the patient's life. You know, But this thing, so government will need to have, so it will make me feel a bit more comfortable. We have a good dialysis machine we are using, good doctors are there, but the other incentives that we need, government really need to do, and then we become a whole comfortable with whatever we are trying to do.
Let's talk about the impact that this having this hospital has had on the community in Ghana.
I must say that ever since the new center was built, there's a much more relief to our patients that we see. And the hospital itself is also getting a very good image because we are getting people coming in from other countries who are bringing a lot more revenue to help us manage the place. Now, patients don't have to travel any longer distance to access specialist urology cases or nephrology cases. All of them are here and we see our patients in real time. If you go to our OPD, which is the outpatient department, we get patients from all the regions in the country coming in to get all of these services being received. And it's much cheaper than to go to a private facility. For example, if you come to this block for consultation with a medical doctor, what you pay is much lower than how much you pay in a private center. The center is also located in the city, so it's not very far from people, so they can easily get means of transport to come over and to be seen. So it's really brought a lot more relief to our people, and you don't have to travel outside. Just come, you receive the best of care that you need.
Before earlier talked about the time it takes for a patient to come through and get a treatment. Like how many times do you have to make a trip to the hospital?
A patient who has been diagnosed of end stage, is a stage 5 kidney disease, the person needs a maximum of 3 sessions a week. So you have to come any other day. So you come Monday, Wednesdays, Friday, or any other day we'll select for you. But for financial reasons, most of them have been coming for 2 sessions. So either Mondays and Thursdays, or Tuesdays and Fridays, or Wednesdays and Sundays. And when you come, it takes you less than 1 hour sometimes to be put on the machine, and it takes you 4 hours to go through the dialysis session. So that will give us about 5 hours you're going to spend in the hospital. And once that is done, you go back home and then continue whatever you are doing. So maximum 5 hours, somebody should be able to go through the dialysis session and be discharged back home.
Financially speaking, does it make sense for you to make all trips there? Is there something they can do maybe make these processes even faster instead of you coming 3 days in a week? Can you come one day or once a month?
I think the best the government can do is what is doing, because sometimes when you take the consumables, when you take, I personally, I normally do research behind the scene, even though we all agree for the price to be less. I do, because the dialyzer alone can cost about 32 euros. The dialyzer alone, and then when you take the lines, another thing, the biocap, the heparin, this thing. But what the government is paying actually is not the rare amount the government is supposed to pay.
That's right.
But I think they are subsidizing it for us. I think that if the government was supposed to pay the rare amount of dialysis, I think we'll be doing around 900,000 per session. But we are doing less 500. It's 491 that the government is doing. So we thank God. But like Oluwatiso said, we ask for more because our labs are very expensive. And even if our nurses and doctors were going to be that strict on us on our labs, we would have had a big challenge. They are very strict on us. They check the labs, bring your lab, do this. But if they were saying like every month continuously, maybe I, for example, as about like 2 months now that I'm going to do my lab. But when you look at it, ideally you're supposed to do it like every month to go and show it to a doctor to know your situation. But because of this financial constraint and all those things, we are not able to. Somebody has been there, and by a year now, he has not even seen a doctor because he has not done the labs to go and see the doctor. And so we can't, but we prefer that they could have taken our BP medications if they can put it on the national health insurance for us, and then we'll be happy if they can do the injection at least. Ideally, no. Once again, it will depend on the doctor. Maybe the doctor might check your labs and get to know that you might need maybe equal for maybe about a month or two, or maybe so. Once it's checked, and maybe if they can give you one injection every week out of your 2 sessions, when you come, they can give you one injection of the equal injection. If government can bear that cost for us, it will be more cheaper. But my brother, it's not easy. And like I said, most of them are youth. They are not working. They are depending on their parents. Maybe the parents who ground zero. So the whole cost involved thing is something. But once again, we thank God for what the previous administration did, and now the new administration is building on it. So we are looking at the way forward. Like we said, we just hope they will engage us in whatever decision they are taking, so that we can also give them idea on the situation on the ground, the nurses, the doctors, the patient, so at least we can come on a round table, get something more concrete. So when the thing comes up, nobody will come and ask questions about it.
James, if somebody was watching this program, let's say from Kaduna, Nigeria, what would you tell them about this center?
We don't have to travel to the UK, to the US, to Canada, to any other country. Just nearby Nigeria is Ghana. And Ghana has such a facility which is well equipped, and their medical professionals are delivering the best of care to our patients. So you don't have to travel around to a different country. Just come over to Ghana, and we're going to help you with that.
Therefore, any final thoughts? If somebody was wanted to look into this facility for possible long-term as a long-term care, or wanted to come and visit that facility, what would you tell them from a patient's perspective?
We don't want more people joining we already. So I'll beg anybody watching this program, yes, I'll beg anybody watching this program that they should do regular checkups.
Right.
Regular checkups. The whole year, every 3 months, if you can go to the hospital to check your entire body. Because one thing I've learned in my learning experience, if they detect it a bit early, they can help you to reverse your kidney back. But if you don't do checkups, you wait, you get to the end stage, you come and join us, and then you be with us. Which you don't even want. They say even if you don't, you hate somebody, you don't wish evil for the person. So we are pleading you should do regular checkup, and then people outside should stop self medication, over the counter medication. People should stop. When you think you have headache and it's severe, go to the hospital. Probably it might not be headache. Maybe your BP is very high. Doctors can check and then maybe give you a proper medication. Because you might think this BP thing, your head, you go and buy paracetamol this before you are damaging your kidneys. We plead with people watching that regular checkups will help them, and then they should stay focused. Those on dialysis too, please listen to instructions. Listen to instructions.
Any final thoughts, James?
Thank you very much, Paul, for this opportunity. Governments must invest in the healthcare sector of their countries, and governments must also do more in preventive healthcare than the curative. Because if you prevent people from getting sick, then you will not spend much money curing them from the disease that they have. And also, a big thank you to Paul, for this opportunity to have this conversation on your channel.
Yes, we'll end it there. Thank you so much, gentlemen, for this interesting conversation.
Thank you very much.
Thank you, James. And before, James Amoa is the lead nurse at Ghana's Urology and Nephrology Center of Excellence, and Kwado Bafua Ahenkoran, president of the Renal Patients Association of Ghana. We want to know what you think about Ghana's Urology and Nephrology Center of Excellence. Drop us a comment in the comment section below. Don't forget to like, follow, and subscribe to Paul Ndiho on X, Instagram, Threads, Facebook, LinkedIn, Blue Sky, and YouTube.